Good afternoon, everyone. This is Kelly Smallridge, President and CEO of the Business Development Board at Palm Beach County, and I want to thank all of you for joining us on this call today. As a courtesy, I'd like for you to please mute your phones so we're not interrupted by any background noise. Today's call has been sponsored by our friends at Florida Power and Light. A special shout out to Don Kieslewski for allowing us to do this. We greatly appreciate your support, as well as so many business, government, and education leaders who have joined us on the call this afternoon as we continue to provide you with up-to-date information relative to this pandemic. And again, our goal now as we shift in these latter weeks, since this is our sixth call, we're shifting more to a conversation of what does the new norm look like and restarting and business recovery. We're fortunate today, in addition to having so many leaders on the phone, we're very fortunate to have Corey Sabin, who is the president of Video Bolt. Corey has a 20-year career in sports and newscasting, public speaking. He's excellent at coaching companies that are in crisis. He's a master moderator. Corey's going to take over today's discussion as we navigate between the four speakers that we're so thankful to have with us today. Corey, it's all yours.
Thank you so much, Kelly, and good afternoon, everyone, and welcome to all the callers joining the line. I'm Corey Sabin, president of VideoBolt.com, and today's moderator, as Kelly said. Thanks again to Florida Power and Light and their wonderful team over there. This is a live telephone town hall meeting from the Business Development Board of Palm Beach County, also being broadcast live on ESPN West Palm 106.3 FM. We're in the process of bringing on hundreds of people onto the telephone line to participate in this live event with government and business leaders from all over Palm Beach County. I ask that everyone please mute your phones so we are not interrupted with any background noise. If during the call you have any questions, please chat our BDB host by hovering over the bottom of your screen and clicking the chat box on your taskbar. Thank you. At this time, I'd like to welcome our first speaker to the call, Mark Wilson. Mark serves as president and CEO of the Florida Chamber of Commerce. He leads the substantial political, lobbying, grassroots, and economic research operations of this influential business advocacy organization. We welcome him on the call to provide an overview on the Recovery Task Force. And Mark, if you could, give your statewide perspective. Thank you for joining us.
Yeah, of course. And Corey, thank you for having me. Kelly, thank you always for the invitation as well. And look, folks, we're all in this together. We may have 67 counties and 412 cities, but we've got one state, and we're all going through this together. We're going to figure this out together. So just, I know we don't have a lot of time today, but I do want to try to give some perspective from the statewide view anyway. Just big picture, let's keep in mind Florida from an economic standpoint. If we were a country, our state would be the 17th largest economy in the world. And I think it's important that we think about that. In terms of COVID-19 and what does it mean for Florida, I think what we've been doing, we've been looking at this from a county by county standpoint. And I think Kelly mentioned in her opening remarks about recovery and restarting our economy. I think we need to look at this from a perspective of, the White House has put out guidelines for all 3,007 counties across the country to follow. All 50 governors will soon be putting out guidelines for regions and for certain sectors of the economy. But the real action, the real efficacy from both a health perspective and an economic perspective is really going to be at the local level. How well can you all work together in Palm Beach County and in the surrounding counties when you restart your economy in every single level? And so my suggestion is, from a local framework perspective, we be thinking about it that way. When I think about Palm Beach County, you're about 42 or 43 days into this since you had your first case. You're testing at about 12% positive right now. We need to figure out how to get that way down under 2%. So as you look to reopening your county, everybody should be paying attention to to testing percentages and what the overall trend needs to be. That's going to increasingly be important. You had your first case March 12th, your 100th case March 24th, your 1000th case on April 5th, and you're now at about 2,500 cases here as we approach the end of April. And again, successful opening up of our economy is really going to be about flatlining those numbers and then getting our testing, our positive testing way down. Also, Kelly and Corey, I would tell you the Florida Chamber has been doing quite a bit of statewide polling, both of voters and also of businesses. And I would tell you businesses are 4 times as concerned about customers coming back as employees coming back. We obviously have about 22 million people in our country who are unemployed right now, and everybody wants to get back to work as soon as it's safe to do so. But I think as we think about whether this recession is going to be a V-shaped or a U-shape, it's looking a little bit more like it's slanted toward a U-shape. It pains me as chamber president to say that. But what I really want to highlight here is, so how are we going to work through this? We see recovery from COVID in really 4 stages. Our federal government has already invested about $5 trillion in various relief and stimulus efforts so far, and I think we'll see a 4th package and a 5th package before we're all done. The phase we're in right now is what we would call restart. And so, in the coming days and in the coming weeks and in the coming months, we're all going to be trying to restart this economy that we on purpose shut down. We brought it to a stop. And so the global economy and all of our supply chains are going to try to get back up and running again. I hope no one thinks it's going to be literally like a light switch. It's going to take a lot of give and take. It's going to be a bit like an accordion. Once we get the economy restarted, then our focus after this phase will be on recovery. How do we get back to where we were in the beginning of March, to pre-COVID levels? And I said yesterday to a group, 2020 is going to be a record year. The first 3 months of the year, many companies were headed towards having a record year, their best years they've ever had. And sure enough, 2020 is going to end up being a record year, but it's going to be the wrong kind of record year for Florida and for a lot of companies. I think just to give some perspective also to what we're looking at the state level, Florida is unlike many other states. And I'll go on record right now as saying that despite what we hear on a daily basis, I believe Florida is one of the most prepared states in America to open back up again. And it's because of the way we did the gradual shutdown. We did it one place at a time, one sector at a time. And there's always going to be lessons learned. But I think when the analysis is done of all 50 states, if we continue to follow the data, if we continue to follow what our healthcare professionals are telling us, and I promise you, I work with the governor's team on a daily basis, everyone up here is following what do the healthcare professionals say is the right way to go about reopening our economy. But Corey, before I turn it back over to you, just a couple of quick things to remember about Florida that makes our restart and recovery a little bit more challenging, right? So remember, we do not have a personal income tax in Florida. We're one of the few states that do not. And while that's a great thing, it puts a premium on sales tax and use tax. And so if you think about the significance of our tourism economy, we have almost 130 million tourists that visit Florida or visited Florida last year. 14 million of those visitors came from another country. Of the 900 new residents we add in Florida every day, 810 of them every day are from another country or from another state. So think about the transient nature and think about the challenges in a post-pandemic environment that's going to pause or create. 20% of Florida's tax revenue comes, of our sales tax revenue comes from the hospitality, tourism, restaurant industry, hotel restaurant industry. So think about that, 20%. Speaking of 20%, about 1 in 5 Floridians are seniors. And so think about vulnerable populations in a post-COVID environment. Also, in terms of sales and use tax, about 79% of the general revenue to the state of Florida comes from sales and use tax. So we've had a quarter where we've on purpose shut down our economy. What is that going to do to state and local revenues? It's going to be a real challenge for us to think about that. And then finally, Corey, we're only about a month away from hurricane season. And so this is the time of year we all start thinking about sheltering in high school gymnasiums and civic centers where we all huddle together to protect ourselves from hurricanes, and we're not going to be able to do that this year. So bottom line is I'm very optimistic about the way Governor DeSantis has put together different teams and their reliance on health data. What I would say to my friends in Palm Beach County and in the region is once the president and once the governor say, okay, we can start the reopening of Florida, I really want us to all understand this is going to be an ultra local situation. And I want to remind us, just because we're open doesn't mean we're not going to close again. And we're looking at over 100 countries right now. Many nations are 4 to 8 weeks ahead of the United States on the COVID curve. And some countries like South Korea, they have a lot of restrictions in place, but they've managed to keep this at bay. Other countries like Singapore, and I think there's a really important lesson here from Singapore, they were down to only 3 new cases a day in the country of Singapore. They started going back to work again. They saw an explosion in the spread and in the cases. And then Singapore, for a second time, shut down businesses. They shut down all travel in and out, and they shut down schools for a second time. So I would encourage us as leaders to, remember that story we used to hear when we were kids about the tortoise and the hare. And if we want the quickest possible and the safest possible recovery, then our mayors and our county commissioners and our state, led by the business community in Palm Beach, needs to make sure we're on the same page. And if we can get economic developers and local chambers of commerce on the front end of this, I'm very optimistic that those are the counties and regions that are going to get this right, and they're going to do it on a sustained basis. So with that said, I appreciate the invitation today, and looking forward to working with everybody.
Mark, thank you so much for your insights. You mentioned there are 4 phases, and currently we're in that restart phase, as you put it. And obviously it's a fluid situation. You're also a member of the governor's task force. Can you tell us what their role is, what they're doing? What are some of the recommendations that are being made? And give us some insight into that behind the curtain, if you could.
Yeah, I'd be happy to. And I don't think anything, it's interesting you phrase it as behind the curtain. I don't think there is a behind the curtain. I think everybody sees what's going on. But for people who, really haven't seen it, I'll be happy to give a perspective. First of all, there are several task forces at the state level that are working on this. The executive committee, I believe, wraps up today. Maybe they'll do a little bit more work in the future. But I think what we're looking at here is, looking at the White House guidelines of when is it safe to open up again. And if you look at the executive orders, the Safer at Home orders and others that we have in Florida, if we begin relaxing that, how do we make sure that going back to work is actually going to work and that it's actually going to be safe? Again, the only thing worse than slowly going back to work is going back to work and then having Singapore happen to Florida, where we have to go through a second shutdown and maybe schools are closed for a full year, or maybe travel's closed for a full year. So life is going to be a little different, I think, this so-called new normal. But what we did this week in Tallahassee, what all of the task forces have been looking at are all of the different industry sectors, right? Which ones could go back in a relatively easy and quick fashion with some safeguards in place. But then when we've looked at all 804 job occupations in Florida, which ones can you do, more than 6 feet away from a customer and more than 6 feet away from a coworker? All of these industries will eventually be able to go back to work safely, but you might have different precautions if you're building a bridge and you're in a cab by yourself all day than if you're in a truck with 3 other people all day. So what we're really looking at here is what's the right way to phase in regions, what's the right way to phase in industry sectors, and then what are the right guidelines for businesses and for counties and cities to follow. So Corey, the last thing that we want in Florida are 67 different ways to reopen Florida, or worse yet, 412 cities with 412 different sets of rules and guidelines. So I would imagine, next week, week after, we'll really start to see some specifics on sort of what these guidelines might look like. And then it's really going to be up to our local leaders and our local business community to operationalize these at a local level. I don't think you should expect the White House or the governor's office to, put together an extremely detailed blueprint and instruction manual for what's best on the north side of Palm Beach County versus, say, the west side. I think that's really going to be up to you at the end of the day, and that's the way it should be.
Mark,
good question.
Looking at the economy in the state of Florida, what do you think the impact in this budget awaiting signature by the governors will be? What is it? What are we looking at? What can we expect in this upcoming budget? What cuts and what will the impact be, if any?
Yeah, so to be fair, right, we've worked very closely with the governor's office on trying to figure out what the reopen would look like. Candidly, there hasn't been a lot of discussion in these groups about the current budget, the one that the legislature passed that the governor needs to make decisions on. I would imagine, I mentioned a few minutes ago about this being a record year. It started off great, and now it's going to be a record year for a lot of companies on the negative side. I don't know, this could be a record year for vetoes if you think about it, right? If Florida was a business, you have to expect that revenues have fallen off when, the only source of revenue that we have are tax revenues, if you think about it, in general revenue. And, all of us have been working remote. Automobile sales is the #1 source of sales tax revenue in Florida. And, you have to know that if automobile sales have been down over the last quarter, you have to know the impact that that's going to have on sales tax revenue. So, no one really knows how deep this fell off, but you have to imagine that it fell off enough that it's going to impact this year's budget. In terms of, what can be done, the governor does have the ability to use a veto pen. And I think, when our economy was growing so fast in the first quarter, I think that, we're in a different situation now. So I don't know exactly what the governor's going to do, but I know that most people in that position would be thinking about preserving cash. And that might mean, it might mean a record year or something like that on vetoes. The next question everyone asks, Corey, is, are we going to head to a special session? And, conventional wisdom would say yes, but I don't think that's a guaranteed deal either. We really need to see the next 30, 60 days how this plays out. What does the restart and reopening look like, and how quickly do things come back? And to my point earlier, is it more of a V shape or is it more of a U shape? And that's really going to determine whether the conversations about huge cuts or whether the conversations about new sources of revenue, how do you stimulate an economy so that we can generate tax revenues the fastest? Those are yet to be determined, and frankly, those have taken secondary position to the health and safety of Floridians. The conversation up here in Tallahassee is really about how do we keep everybody healthy, how do we keep everybody safe, and how do we do a successful reopening? But to your point, sooner or later, we're going to have to get around to vetoes and cuts in revenue. It's a fair question.
Mark, last question, if you could, relatively briefly. You mentioned that you envision a couple of more rounds of funding. Being in your position, there's a lot of businesses, small businesses, as you know, that are hurting right now. As the BDB moves forward to craft a strategy for recovery, what's your call to action? What do you want the business leaders to know? What can they do to help?
Sure. So thank you for that. So like I say, our federal government's already invested about $5 trillion of all of our money, our tax dollars, back in this. I would expect to see a fourth round and a fifth round. I think there's going to likely be an infrastructure play, but also hospitals have been hurt badly, right? We asked them to stop doing elective surgeries. We basically asked them to clear out so that they would be ready for all of the COVID patients. Some of them showed up, some of them didn't. Local governments, right, are in a pretty big pinch right now. And so I would imagine another round from Congress will be some hospital supplements, also some local and state government supplements. In terms of what the BDB can do, Kelly's already doing this together with local chamber leaders in Palm Beach County. We've released a framework that we believe local business leaders could use to work with state and local leaders. And so I would say organize locally a framework with all the right leaders and take control of what's going to happen in your own backyard, and don't wait for somebody in the White House or in a governor's office to do it. You know your community better than anybody else does. And I would say, Corey, don't forget about the zip codes where we have a lot of kids in poverty. They're the ones that could get left behind, and so please put them front and center. They deserve it, and we're going to be focusing on it. But anyway, thanks for having me today.
You got it, Mark. Thank you for your thoughts, your leadership, and your guidance. Have a wonderful weekend. So let's focus hyper-local here on Palm Beach County now, and we're pleased to have the County Administrator, Virginia Baker, as our next speaker. Virginia, it's great to have you. If you could you please give us a county update?
First of all, good afternoon. And I would like to thank the BDB for putting this on every Friday. It is very informative. I'd like to thank Mr. Wilson for his words, his vision. I can't say thank you enough for helping us focus more on where we really want to be and the balance between bringing businesses back and keeping our community safe. Is going to be definitely a fine road to walk. But I believe that working together, we'll be able to accomplish it here in Palm Beach County. I want to talk about testing, and he's absolutely correct. We're roughly about 12%, but we're down from almost 20% positive rates coming back. So if we continue with the working together, wearing our facial coverings, staying at home when sick, washing of hands, physical distancing, and if you don't have to leave your home, then you are safer at home. That has worked very well for us here in Palm Beach County. I believe that we're where we are today with a downward trend on all our indicators that will help us start to move forward and restart our economy. We are testing still at our South County Civic Center site with our partner Cleveland Clinic. Anyone over the age of 16 is welcome to that particular site. You either have to have a fever, and if you don't have a fever, if you have shortness of breath or a cough, you can call and make an appointment and go through that particular testing site. The drive-through testing at 15 Ballpark of the Palm Beaches, we've surpassed 10,000 patients that we've tested so far. The West Palm Beach test site is by appointment only, just as the South County site. And so please make sure that we're going out to be tested. That is going to give us a lot of data. It will support us starting to move forward with a restart for our community. We also have a testing site out in the Glades area, and Commissioner McKinley was very instrumental in ensuring that we had a test site out there. We just recently expanded it. It started out as a walk-up testing site. We expanded it to a drive-through as well. And so we're also talking to our partner at the 15 of the Palm Beaches to add a potential walk-up site. We're working through that issue right now. So please, you are all business people. We want to make sure the ones that are still open, that you remain safe, your employees remain safe. So please encourage them to call, make appointments, and go in for their testing. In addition to that, I'm sorry.
Oh, thank you, Verdina. I think that's a wonderful update. I was going to ask you, when do you think the county will move forward with a recovery task force?
Well, we're working. I've spoken with Ms. Smallridge as well as Ms. Jacobs at the Economic Council. We were waiting to see what came out of the state task force, because we believe that we will be in line with them. We're looking at our industries hit the hardest here in Palm Beach County, and that's hospitality, restaurants, retail, personal services, and agriculture, believe it or not. And so we want to make sure that we're pulling together the right working groups so that we can come up with a strategy to help phase in our restart of our businesses. And again, all of this is going to be in conjunction with our medical people advising us the science that says it's time to move from one phase to another. We work very closely with the Department of Health, and we're going to be working with other health advisors. And so as we develop these working groups, we will have our health people involved in the plans as well.
What else would you like to share with us in regards to opening, the recovery, and the strategies that are being put in place?
Well, again, we've started with the planning aspect of it. The strategies are going to come from the working group, the people on the ground involved that knows what they need in order to restart their business. We're looking at some of the CARES dollars that the federal government has allocated to us. We know that a substantial portion of those dollars will need to go and set up possibly as a grant type program to help our small businesses and some of our medium-sized businesses that the federal government does not assist directly in restarting their business. And so we're starting on the county side with staff, starting to look at such programs, what would they look like, and then hopefully fold them in with the working group so that we can maximize the dollars that we receive from the federal program.
And what will be the guidelines for perhaps loosening social distancing? When do you perhaps see that happening? Obviously, very fluid situation.
Very, very fluid from one day to another. And I really cannot tell you that. I would lean on the health and science people to tell me when it is time to reduce the distancing.
Communication, obviously vital in a time like this, a situation of crisis, very fluid. How often will you be updating, and will the county be updating, I should say, with press conferences to inform the public and let us know of what's going on?
Our strategy has always been to hold press conferences when we have new additional information to provide to the public when it comes to press conferences. However, we put out a press release every day. We update our webpage every evening so that information is out there. We highlight the new aspects that people should pay attention to on that webpage. So please visit pbcgov.org. There is a COVID-19 page that will have all of that relevant information on it.
Once again, that site is pbcgov.org. Verdina Baker, thank you so much for joining us.
Thank you.
Reminder that today's town hall is being brought to you by FPL. We thank them for sponsoring today, and of course our friends at ESPN West Palm Beach 106.3 for broadcasting this live. Virginia, Mark Wilson, thank you for our leadership, your leadership. And speaking of leaders, we're proud to have Gina Melby with us. She is the CEO of JFK Medical Center, a well-respected leader throughout Palm Beach County. Gina, please tell us what's happening at the hospitals and what information you could share, please.
Sure. Good afternoon, Corey. Hope you can hear me, correct?
Yes, we can hear you loud and clear.
Great. Thank you again for having me. Thank you, Kelly, for including me on today's town hall. This past 6 weeks has been an extremely challenging time for all of us. And as I hear from the different speakers today, really an incredible insight as far as what we're doing at a state and local level. As you know, the healthcare systems have really worked very, very hard over these last 6 weeks to be prepared and to be ready, especially under the governor's order as far as what he determined was for us to empty our facilities to be prepared for COVID patients and to assure that we have the equipment and the supplies necessary to take care of those patients. So all of our hospitals across Palm Beach County are pretty much operating about 50% occupancy today in the preparedness for what we would see as that spike in the patient population. Today, we've seen close to 1,470 patients of what we've tested here at the facility, and I'm speaking specifically about our main campus and North Campus. We're 803-bed system. We've had over 193 patients that were positive that have been discharged and have successful treatment. So we're pleased with what we've seen in terms of the care of those patients. Of course, we've had some mortalities as we see across all of the country, and it's been very difficult in terms of the management of our patients. And the hospitals are very different today. What you walked into 6 weeks ago were very busy facilities across our county. Visitors, doctors, families, patients, everyone coming in and out, where we had to shut down in a very short time and assure that we had what we call separate entrances. We were limited to entrances. We are testing every single person, every healthcare provider that walks into the facility today, and we ask a series of questions from a protection standpoint, continuing to screen our patients and our colleagues. And at this time, we are also testing all of our admissions and all the patients coming in right now, and we call it universal testing. Again, visitation policies have been completely eliminated. We have no visitors at this time in our facilities. We continue to look at infection prevention. We have universal masking. Every physician and every healthcare provider is in a mask all day long. There's different levels of masking depending on where you are providing care for patients. We had to take into account what we call the cohorting of patients, assuring that all COVID patients were in designated locations with designated rooms, and assuring that the staff taking care of those patients understood the proper, what we call donning and doffing of PPE equipment. That's their masks, their gowns, because that is safety that protects them from being exposed, and that requires education. So we had to ramp up on that for both physicians and for employees. So we are fortunate that we have a tower that has our ICU patients. We have our positive patients. We have what we call patients under investigation. So we've actually moved many patient rooms around to assure that we had these dedicated areas. Ventilators are of great supply, so we are fortunate that we have what we need for ventilators. And again, we work very closely, not only within our own systems, but across the county, across the state. I do work for a large company, so we have a very large infrastructure and a supply chain that helps to support us, but they also are out there helping support others. I think for today, right now, the clinical management is critical. As I said before, we're doing universal testing, and that wasn't in place when we started back in the early first week of March. So we are testing every patient coming into the facility. We are using hydrochloroquine and those necessary medications based on the treatment protocol. As you all have been hearing, convalescent plasma is the new investigational medication that has been under emergency use under an investigational review board. And we are now beginning to deliver convalescent plasma to those patients that had already been positive that have to meet a series of timelines to be a donor. And we are administrating the plasma to patients today. We are also trying to work on a rapid trial, which does testing within 15 minutes. So that actually started today in our emergency department. That's a sensitivity test that has to be tested against our current normal test, our testing results from the beginning. It took us 8 days to get results back, and today we're down to 10 hours. So that has made a huge difference in what we do. The key for us right now is, as I've walked through a 6-week period of time, is the next phase, which is hopefully with the governor's executive order, hopefully expiring on May 8th for allowing us to get back to business, which is now allowing patients to have the elective surgeries. We are preparing for that. And that is, as difficult it is to open up a restaurant. We have fear about coming into a facility. We have concerns about people being tested. So we are doing a tremendous amount of work. My infectious disease chairman works side by side with us every day. We meet with our medical care providers every day to assure that we are doing everything necessary. So what we look at the framework going forward is we anticipate that universal protection is now where we're going to be every single day. So our masking is going to stay in place, and series of what we need to do are related to that. We will continue with PPE equipment because we still believe people will come in and test positive, and we have to manage that. So we will continue that. As I said, visitation will still be limited. We're going to still screen everyone. We're still going to have separate entrances. We will have social distancing. You may not see vending machines in a hospital. You may not see coffee machines. You may not see the things that you normally saw before. Cohorting is going to be critical and paramount, because as a patient coming in now, because everyone is fearful to come in, but yet there's many people that have delayed their surgeries so that we could go through what we needed to go through to prepare for this pandemic. But now coming back in is even more of a fear for them, and their fear of being exposed and having being able to contract that virus. So we have to do our best to instill confidence in our patients through our healthcare providers, through our physicians, and we will do that with a very controlled framework as we move forward to assure that we still maintain those CDC guidelines. We still maintain that cohorting. We call ourselves the green side of the hospital, in an area that's a red zone versus a green zone, and the red zone is restricted for those that are caring for our COVID patients, and we will continue with that as we move forward. PPE has always been a topic of discussion, and there's a lot of controversy of what bringing homemade masks versus masks that everyone thinks that are appropriate. We have to assure that they are healthcare regulated. They have to have splash fluid ratings on the masks themselves. So therefore, and you have to be fit tested appropriately to assure that your masking secures you when you're taking care of patients that have contracted the virus, particularly those in the ICU who are vented and who are going through these aerosolizing procedures that are very critical. And again, taking care of the patients are at the forefront, but assuring the safety of our staff is critical as well. So I know I went through a lot. If there's, I could answer any questions that you may have, Corey, or anything that you want me to share or that I may have forgotten.
Thank you, Gina. That was very great information. But curious, the CDC warns of a next wave of coronavirus. What can you possibly do to prepare for this and the response?
So I think the reality is that we have to just know that this is going to be forthcoming. And I think, again, I feel that we're going to maintain the infrastructure that we have with cohorting. I don't see us changing cohorting. I think we're going to be prepared to maintain patients that are going to test for coronavirus. If we have to move to where we have to decrease our census again, if you will, then we would have to then go back to see that there may be a chance that we may not be able to do elective procedures, so that we could assure that we have the number of ICU rooms available, the number of ventilators that we need available, assuring that we have enough PPE. But I think the PPE supply chain will continue to improve as we go forward, because I'm relying on our resources and our guidance and our task force here within our system to help us with that.
You mentioned elective surgeries. When do you think you'll be able to get back to that?
So May 8th is when the governor's order should expire, and we believe that that will be expiring. So we're working very closely with the surgeons. I think the most important piece is the communication with the patients. They have to have a sense of confidence and security in the healthcare systems here, that we're going to do everything we can to protect them, to ensure that they are safe, and that's our primary goal. So we are actually thinking that that's going to happen, and that's some of the direction that we're getting. I know that the Palm Beach Medical Society did send a letter in support of the governor to let the order expire and to let the surgeons and the healthcare systems continue to go back. Again, it's going to be a gradual process. It will be phased for us just like everyone else, and that term universal protection is really going to be key for us as we move forward.
You talked about plasma. If you could tell us about the need for plasma donations and where people can go.
Okay, so I do have a little bit of information here. So there's definitely, you have to go to OneBlood. They have a online information that I can obviously send out. But again, in order how you to help, you have to make certain that you must be an eligible patient to donate blood. You must have had a prior diagnosis of COVID, and it's documented by a laboratory test. You have to be fully recovered, so there's significant criteria, but OneBlood is the entity that you can go to, and you can go on their website, and they will direct you on how to become a donor.
And a couple of questions coming in. First question, should businesses be screening employees upon reopening for possible virus? If so, should they be screened for elevated temperatures?
So we are screening all of our employees as we come in today. So we have temperature checks at our front door. We are asking a series of questions. So what we're doing here at the hospital is, yes, we are screening all of our employees. We're not testing all of our employees yet, because testing right now is really focused on the patients, and we're not sure where that testing will go, but we are doing 100% screening of all employees and all physicians coming into the hospital.
Do you think his question was regards to his business and other businesses? Do you think they should be screening as well?
So I think that is probably something that will come out of the task force. I think that is something that people may want to consider, depending on the business itself. because if somebody comes in with a temperature, but that's one of the pieces that could guide you. Asking a series of questions, we just would hope that people would be honest about that, but I think it's something that we might have to consider as we do open up some businesses.
Here's another question. Linda would like to know, in regard to discharge planning, since nursing homes are no longer an option, what has changed?
Well, nursing homes are an option for discharge. What we are doing is we are assuring that the patients test negative before they're discharged, and sometimes we want to make sure that they are tested and have a negative twice, meaning within 24 to 72 hours, 48 hours, excuse me. So we are still discharging to our skilled nursing facilities, and we're really partnering. I think part of what we have to do also is to help support them and educate them, because it is really critical for the needs for some of these vulnerable population of patients to still have a place that they need to go to. So we still are discharging those to those skilled facilities and getting patients from those facilities every day.
And based on what you're seeing in this first go around with COVID-19, and let's hope there's not another one, even though it's predicted, do you think we spiked already?
I do think we spiked, but I hate to say that in case something changes, because I did see a difference between last week and this week. I would say I've been leveled off. We had a definite spike in probably about, I want to say 10 days ago, but I do see some leveling, but I don't want to put myself out there that that may not occur again, because it's possible that something else can change.
And last question for you, Gina, if you could, what can the BDB do to help in recovery?
Oh, I think, as I told Kelly and her team, I think whatever we could do to help support the knowledge for what businesses can do going forward. And I think all of us have talked about having those healthcare professionals and the scientists help Kelly in any task force to guide some of our businesses and openings. So I do believe that Kelly and her team do everything they can to get information from us, and whatever we can do to provide information to help support the business community from a healthcare perspective is what I would see us doing for the BDB.
Gina, thank you so much for your guidance, your leadership, and keep up the great work on the front lines.
Thank you. Thank you, everyone.
Our next speaker is Wendy Link, the Supervisor of Elections. Wendy, it seems every presidential election, all eyes are on Palm Beach County. This year will be no different. You'll probably have even more eyes. If you can, tell us what's going on at the elections office and what can people expect, and talk about some of the changes that we should expect. Wendy Link joining us in a moment. As you know, a lot happening in this upcoming election in November.
Hi, Corey. Sorry, I had it on mute.
Oh, that's all right. I've had worse, Wendy. If you tell us about some of the changes that we can expect in November, perhaps fewer polling places because of COVID-19, and some of the changes that the average voter can expect.
Right.
And
I think
business leaders help as well and volunteer.
Great, thank you. So we are still open at the elections office. We're considered an essential business, obviously, particularly during an election year, because this takes so much work to do. Currently, we are waiting for guidance from the governor and the governor's office we sent a letter asking for some guidance and some flexibility, so that we might deal with the election and maybe a way that would be more helpful to voters. So we're waiting to hear back on that. In the meantime, what we're doing is focused on pushing vote by mail. And vote by mail is really, we're doing it as a safety issue, not a political issue. As you know, this virus affects people of both parties the same. So for us, it's just trying to say, while we know that voters like to have really all three ways to vote, both election day voting as well as early voting options and vote by mail. Vote by mail is the one that right now is the safest. And it's important for people to know, by filling out a vote by mail request does not mean they cannot vote in person, should the circumstances be at the time where it is safe to do so. So as long as they have not sent back in their vote by mail ballot, they can still go to the polls. But what this allows us to do is to send them a ballot. It is it comes back, it's return postage paid, so it's very easy to do. And right now, that's the safest thing. Of course, with Palm Beach County, we have a lot of voters that are over the age of 65 and that are in that vulnerable population. We've seen what happened in Wisconsin and what's resulted from that, and we want to make sure that we can do all we can to avoid that. In the meantime, we're expecting the number of vote by mail ballots to at least double, but could be as much as triple. So we're looking at what's going to be involved with that. In line with that, we're going to be sending a mailer out in the next week or so to one per household, to every household that has a voter who has not requested vote by mail ballot in the past. And so there'll be postcards attached to that for the voter to be able to send back in to make a request, as well as directions for them to go on our website to do that. So we're pushing that, again, just for the safety of our voters. We do expect that there will be still early voting and election day voting in Florida. So we had this time 16 early voting sites, and that's the most that we had in this county in the past. I expect we'll have at least that many for August. And we're waiting to find out whether or not we'll expand the number of days for early voting and whether that makes sense to do. August is typically a low turnout election. November, of course, is a large turnout election, and we will use absolutely the full number of days available to us in November, and looking at what makes sense for August for early voting. And then on election day, it's just a matter of having the sites available to us and the poll workers. A lot of the sites are private sites, and they have indicated to us that we will not be able to use those. That's actually the largest number of sites we have are private sites. So we're working on what will election day look like.
And Wendy, as you mentioned, people can still go to the polls as long as they've not sent in their ballot by mail. A lot of people naturally concerned about safety. At a lot more places, we've been seeing these plastic shields up in places.
Right.
Couple of questions. How many more sites do you need? And additionally, what type of precautions, safety-wise and or cleaning supplies, will be at these locations so people feel confident in showing up?
Right. So the how many sites we need is going to largely be determined by the information and the guidance we get from the governor's office, which we're hoping we'll receive soon. If we're able to be in early voting mode, they call it, which means that a voter can go to any site, not just their specific precinct, we won't need as many. If we're not able to do that, then we'll be looking for probably about 200 sites because we've had about 200 private sites indicate to us that they do not want us to return. So we'll be looking at that. In terms of how we are working with the counties, right, the county's been very helpful to us now in trying to help us get the PPE that you talk about. We had ordered a lot for March, and as even if we were able to find it and it didn't say sold out, what we found is days before, when they would get ready to ship it, we would get a notification saying that, you know, even though we may be considered an essential business, we're not frontline responders. And we understand that. But what happens is a lot of times our orders will be diverted to either military or to hospitals. And so we are trying now to get those orders in so that we can have things. And we hope to, at a minimum for the poll workers, to have masks, gloves, and as you mentioned, we are in the process of ordering those plexiglass dividers so that something will be between the poll worker and the voter as they go. We'll also be looking to have the disinfecting wipes so that we can wipe up after the voters. And again, a lot of that depends on how many people we can get to work at our sites. So we're working on all of that now because we want for the voters who do choose to go to the polls to feel like it's the safest environment that we can make it.
And Wendy, to that point, I'm sure there's a great deal of trepidation from poll workers. What plea would you like to make to potential poll workers to come on out and help staff those locations?
Right. So we have 68% of the poll workers that we have currently registered to be poll workers with us are over the age of 65. So that kind of puts into perspective what we're looking for replacing. And so anybody, any of the companies that have businesses, the businesses that have employees that maybe are not in that same vulnerable position and would be willing to, it is a paid position. So if you're willing to lend us your employees for the day, if they're able to do it, as I mentioned, it is a paid position. We will be paying these folks. We know that there are a lot of people who are out of work, and that may actually be an opportunity for us to bring some new poll workers in who we haven't had in the past. So we're hoping that we can get as many poll workers as we can, and also for the businesses to just make sure that their employees know that vote by mail is available to them. And like I said, and it doesn't necessarily take away any of their choices. It just gives them a safe option should they choose to exercise that when it comes election time.
And Wendy, if someone hypothetically was voting in a gated community and that location is now closed or it's been moved, how will they find out and how soon?
We will, as soon as we know, again, what we'll be doing with the governor's office, we will send something out as we learn about the closures and we know where we can relocate people. We'll be sending out new voter information cards, and that's how they'll learn about that. We also will continue to keep our website updated. But if a person's polling location has changed, they'll get a new voter information card in the mail.
And if you could, share that website. It's a wonderful information source.
Sure. It's www.pbcelections.org. And it's a very easy to use site. And for people who want to go on the site to do a vote by mail request, it takes less than 2 minutes.
And the importance of pivoting. So hypothetically, the White House makes changes to how we vote in November. Do we have the resources to pivot and to dance and to succeed?
If you're talking about going to an all-mail election, we would need to know that really immediately, because that would require us, if it's an all-mail election, that would require us to buy new equipment. And that's a big capital expenditure, which of course, if we were to go that way, hopefully we would be getting some funding from the federal government for that. So we could do it if we knew now. Right now, as we are expecting maybe a double or a tripling of vote by mail, we can handle it with our existing equipment and just adding really, we could go to double or triple shifts and just be working 7 days and 24 hours around the clock to handle it with the equipment we have now if it doesn't go to all mail. To put it in perspective, we have about 982,000 active voters now. If we were to go to all mail, we would also send out to inactive voters, so that puts us at about 1.2 million. In March, we sent out 160,000 vote by mail ballots. So you're looking from 160,000 to 1.2 million. There's a lot that would be involved, as well as working with the post office to make sure the post office could handle that kind of a volume.
Okay, so Wendy, we definitely know we need to be nimble. Great resource, pbcelections.org, the website. We thank you so much for your time. We appreciate your guidance, and fingers crossed everything works out fantastic and the eyes of the world aren't on us.
We're hoping so.
Well, thank you so much to Supervisor of Elections, Wendy Link, as well as Gina Melby, the CEO of JFK Medical Center, Vadinia Baker, our county administrator, and of course, Mark Wilson, the president and CEO of the Florida Chamber of Commerce. We appreciate all of you being with us today. And of course, we want to thank our wonderful sponsor, Florida Power and Light, doing so much for the community and even cutting our bills by 23% in May. Thank you all for taking the time preparing for this call so that we can benefit from your insights, experience, and information. We encourage the business community to tap into these resources. As Kelly mentioned earlier, www.bizhelppbc.com, where they'll be updating information around recovery efforts. Thank you again, FPL, for sponsoring today's call. Of course, the wonderful team at ESPN West Palm Beach 106.3. We have another call scheduled for next week. We'll be sending details early next week. I'm Corey Sabin. Stay safe and healthy. Thank you for your time today. This call is now concluded.